IGEPHA im Gespräch. Der Podcast der Austrian Self-Care Association.
Hello and welcome to IGEPHA im Gespräch, the podcast of the Austrian Self-Care Association. I'm Christina Nageler, the Executive Director of IGEPHA. In this season of our podcast, we're exploring new horizons. How advanced are other countries in integrating self-care into their healthcare systems? What are the optimal benefits of a self-care strategy for the population? And how can we leverage self-care more effectively to enhance individual health and bolster the entire healthcare system? Throughout the seasons, I've gathered fascinating insights and ideas. The discussions from our podcast interviews will aid in shaping our approach to utilize self-care more effectively and efficiently. Today's episode, the highlight of our international interview series, features a conversation with Judy Stenmark, the Director General of the Global Self-Care Federation. Welcome, Judy.
Good morning, Christina. It's great to be here.
Before we get started, let me briefly introduce our esteemed guest. Judy Stenmark is the Director General of the Global Self-Care Federation, a federation of regional and national associations, manufacturers and distributors of non-prescription medicines on all continents. The Global Self-Care Federation is dedicated to a world where self-care increasingly contributes to better health and more sustainable healthcare systems. In her role, Julie orchestrates the strategic direction of the Global Self-Care Federation, managing its operations, fostering relationships with members and key international stakeholders, and representing the interests of the self-care industry. Formerly, Julie led Osteoporosis Australia and the International Osteoporosis Foundation as CEO. She's an accomplished health professional with a master in public health from the University of New South Wales, Australia. Let me come to my first question. GSCF has released notable publications exploring various facts of self-care globally. A significant publication discusses the global social and economic value of self-care. And I'm particularly proud that Cosima Bauer and Uwe May conducted a similar study for Austria already in 2013. Later expanded to cover European states and globally did it, I think, in 2022. What would you say are the critical takeaways from this study and what lessons can we learn from it?
Thanks for that question. Yeah, this was a really exciting project for us, if you like, because it was the first time anyone had really quantified on a global scale, really what is the value of self-care. And since I've been in this job, we've really struggled with that because we go and talk to people like politicians, etc., and they say, well, what's the benefit for me? What's the value? So what we really tried to look at is the global value of self-care in terms of the economics to health systems, but also on a social scale as well. What's the benefit to individuals? Because, of course, not only from a health outcomes point of view, but other benefits are significant. So at the global level, current self-care activities are generating substantial monetary savings, as well as healthcare workforce savings, and totaling approximately 119 billion. So when you think about that, that's really astounding. And what May and Bauer did was look at they grouped the countries. So they grouped countries into higher income countries, if you like, and LMICs or low and middle income countries. But across the board, we saw significant cost savings, but not just savings in health systems, also savings in time as well, which can be quantifiable. So across the board, total cost containment, total savings in anything, time, in money, 119 billion. And that's the current saving. And so what we also did was look at, okay, by 2030, if we keep going along this way, what will then the future cost savings be? And future cost containment is 179 billion. And now these are huge, huge numbers, and they're significant. And I don't think enough people have taken this on board. So, for example, individual time saving. So that's hours that individuals are saving by not traveling to see their doctor because they have a cold or because their osteoarthritic hips are hurting. Perhaps they go just to the pharmacy, they talk to their pharmacist who gives them some advice, or they know what they've got to do. They've got to, perhaps they need an anti-inflammatory, some sort of other pain control, and perhaps they need to do their exercises. But individual time savings, right now, 11 billion across the globe currently through self-care, and that could go to 18 billion in 2030. Physician time savings, a big cost, if you like, on the health system. And that's 1.8 billion physician hours saved right now through self-care. So think about if we weren't saving that, what the extra burden would be on health systems. Right now, productivity days across the board, 40.8 billion days in saving. In 2030, that could be 72 billion. In welfare, 1.9 trillion. And quality of life, or quality's 22 million. So I'm not going to talk about all the numbers. I think the number to remember now is total cost containment by using self-care, by individuals and using self-care is 119 billion. And I think that's huge numbers. And so when you look at welfare, that's also the social benefits as well. But individuals having more time on their hand or not taking mornings or days off work or several days because they've been able to deal with their issue, prevent further issues perhaps. So I think these are incredible numbers. So we've used this a lot, as you can imagine, and we actually just had it published in Frontiers of Public Health, one section of it, because the methodology, which I won't go into, was very interesting as well. And so from that, we took various recommendations about we really need coherent healthcare policy and regulation supporting healthcare. And the other important thing is we need collective action from all the stakeholders and really trying to accelerate universal health coverage. Now, I don't know if you talk about that a lot in Austria and other places, but that is really the major priority of WHO, to see universal health coverage. And by that, we mean people have access to healthcare. And in many countries, though, self-care is all they've got. There are no actual health systems. So I think that's important to remember. Health literacy needs to be recognized as a fundamental catalyst for change. And I think that that's talked about a lot. And I think no one's got to the number of that yet. But self-care is multifaceted, if you like, and includes a variety of healthcare practices. And so there needs to be recognition, basically, that self-care improves health outcomes, and it leads to a health system sustainability.
Well, thanks so much. Yeah, well, Austria, of course, has a great health system, yes, but still no great self-care system. So I guess it depends, and thanks for all these interesting numbers. We have those for Austria as well, and yeah, are also hoping to get self-care on the way in Austria. Another interesting study you launched last year was in cooperation with the World Health Organization. You launched the Self-Care Readiness Index 2.0. And this study identifies 4 essential enablers necessary to unlock the full potential of self-care within a health system. Could you introduce us to these critical enablers for self-care in healthcare systems?
Yeah, sure, Christina. So last year was 2.0, And in 2021, again with WHO, we collaborated on the Self-Care Readiness Index 1. And both these really, I see them as, they were pioneering really in terms of an index. And what was great was that we were able to have the buy-in from WHO. So what we identified in the research were 4 key enablers. And then we based our research then, how we did it in 2.0 last year, on what we found around those 4 enablers. So what these enablers, if you like, are the broad elements needed to realize the full potential of self-care within a given health system. So number 1, stakeholder support and adoption. And I just touched on this a little bit, but we need support and trust among all the stakeholders. And that goes for healthcare providers, which can sometimes be an issue, from individuals, patients, regulators, and policymakers. We need that if we're going to maximize the adoption of self-care behaviors and products. And really, if we want to look at strategies and implementing policies, this is a really key thing, stakeholder support and adoption, because right now we don't have legitimacy for self-care. And that's what we're striving to. And that's one reason why we want to have a WHO resolution on self-care, because it gives us legitimacy around the globe, and it enables us to, for different countries, different stakeholders, who easily go to their ministers of health and talk about self-care and self-care policies. The number 2 enabler is consumer and patient empowerment. So self-care really delivers the greatest value. We know this when consumers have a high degree of health literacy and understand the value of prevention and feel empowered. So what I think self-care is all about is really people becoming active self-managers of their health and being self-care literate, which is a term we're using now, is really important. And we're seeing this a lot more with when people talk about digital tools for healthcare, using digital tools to enhance self-care literacy is going to be more and more important. So that's what that one's all about. And then health policy, of course, the critical enabler. So the extent to which policymakers recognize and support the economic value of self-care, and that they then will then promote it as an affordable health solution, and also provide certain incentives to the health system. And again, all these things contribute to the adoption of self-care products and practices by consumers, patients, providers, and the system itself. And the 4th key enabler is the regulatory environment. So we know that regulations and processes governing the approval of new health products, including switch and reclassification, incentives for innovation, access to products, advertising, all these things help determine the ability of our industry to drive innovation and adoption of self-care solutions. So in a nutshell, the enablers are stakeholder support and adoption, literacy, enhancing literacy, consumer empowerment, self-care policy, and an enabling environment for regulatory affairs around consumer health.
Thanks for these insights. We try to take your 4 enablers and make them also work in Austria. Another question is, I took a closer look to all your studies, and it reveals significant global disparities in the integration of self-care into national healthcare systems. From your perspective, what are the reasons for these variances, and what lessons can be learned from countries where self-care is highly valued?
Well, it's interesting, Christina, I think we were talking earlier. There are a few countries, as you say, where self-care is recognized as important. And they can be countries like the UK, like Australia, like Canada. Government has developed, or in collaboration with various groups, blueprints for self-care. But really, I don't think there's one country where self-care is successfully embedded in policy and their from there, things are starting to flow and change is about to happen. So I think that's an interesting point. I think things are looking good in the UK, and they've had great success this year with the government recognising and developing a self-care a policy and bringing all the stakeholders together. I think that's really good. But I wouldn't say there's anywhere where it's like, look what self-care is happening, and yet look what's happening with self-care. It's definitely embedded in policy. So we might think that self-care is more successful, if you like, in higher income countries, but we have seen exact opposite, that in countries like Burkina Faso, for example, Kenya, Morocco, Senegal, they've taken the self-care guidelines of WHO, which were broadened and consolidated last year in 2022, bringing in NCDs, as well as sexual and reproductive health, which was the original group, the original basis. So they're broadening and broadening, which is great, the guidelines. So those countries have taken those guidelines and they're really trying to implement them and bring it into policy. So I think what lessons can we learn? As I said, I can't give you a great example where self-care is already embedded in policy and highly valued. But I think that's our job, the Global Self-Care Federation, on a global level. And again, that's why we're pushing for a WHO resolution, because we want self-care to be highly valued. We want it to be legitimized. That's why we're doing these studies. That's why you did that study in Austria, the first one, and why ASGP did their European study, and then we followed suit, is because we need to be continually showing the value of self-care. And of course, on a personal, social level, on a health outcomes level, for us, that's the most important thing. And governments, that's important too, but they also want to see, will this save us money? So to me, I feel like saying to all the policymakers and MOHs we talk to, look, it's a no-brainer. It will save you money if you start embedding this in policy. But we've got a big way to go, a long way to go. So yes, there are variances around the world. And look, in some countries, self-care is all there is, because there is no advanced health system like Austria, like Australia, for example. They're just two examples, and they're right at the other end of many countries, say in Africa, in Asia, and yet those countries are starting to do really well in terms of consumer support and embedding it more in policy.
So what are GSCF's core, what's your core message? Why should governments and healthcare systems prioritize self-care more significantly? Just to save money? No.
No, that's the reason. And when you look at many health systems around the world in advanced economic countries are failing, and they're not coping for a whole host of reasons. And just before I start, when you look at COVID, if you like, was beneficial to self-care because it shone a spotlight on self-care. It also shone a spotlight on the pharmacist as a trusted source of advice and health information. And it shone a spotlight on self-care, and you had people like WHO coming out and saying self-care is important because it showed that people don't have to go to the doctor all the time. Of course, some people missed out and should have been seen by a doctor, but it showed that people can manage, or they can have a 20-minute phone call with their GP, do it over Teams. And so I think it really shone a positive spotlight, and some countries realized, okay, we can, with these things that we've done to, say, save time, expedite things, even regulators around the world who expedited approvals of things, etc. Some countries have kept those in place. So I think it shone a positive spotlight on COVID. But I think why should governments support self-care embedded in policy? Because self-care allows healthcare providers to focus on acute care by saving physicians 1.8 billion hours per year around the globe. Self-care increases the productivity of individuals like you and me, saving about 11 billion hours per year globally for that individual. And self-care enabled by enhanced health literacy, self-care literacy, by the use of over-the-counter medicines, devices, and preventive care allows people to manage their health conditions, and productivity can improve by about 40.8 billion days per year globally when they are self-care enabled. So I think we've got the evidence. COVID shone a spotlight. We've got the studies. We've got the evidence. We need to find the magic way of getting governments on board, if you like. And so one thing we just did, Christina, maybe I could just bring up, is we just had our regional meeting in Sao Paulo, Brazil, only a few weeks ago. And we got together with the help of our members there, about 8 to 10 Latin American ministries who are all supporting the Sao Paulo Declaration on Self-Care for Universal Health Coverage. And there are certain important points there, of course, but the major things were about commitment to promoting self-care for primary healthcare and UHC, supporting self-care education and awareness, going along the lines of literacy, leveraging technology and digital solutions, strengthening collaboration and partnerships, which is key, ensuring equity and inclusivity, advocating for better self-care governance, and then monitoring the progress and accountability. So I think that was a really exciting achievement. And what we're looking at right now is how can we all use this declaration and keep using it on a global scale to use. So I just wanted to point that out.
Thanks for these new insights. And it's exciting that Southern America seems to be that far ahead of us.
Well, it's a start.
Well, I'm eager to read more about that. Thanks a lot for sharing these insightful thoughts on the future of self-care globally. And what would be your advice for Austria? What key factors should we consider for a national self-care strategy, or any other recommendation regarding pushing self-care ahead in Austria as well?
Yes, well, I mean, as we said, Austria has a very advanced health system. But every health system, I don't know any governments who don't want to save money. So I think, and I'm sure you've done it, but you've done your own study on Austria. But then you have the European study, and then you have this global study. So I would think packaging the key points, if you like, from those three, and then taking parts of the declaration on UHC from Sao Paulo, which we'll be talking about a lot in Europe, etc. And then say, look, these are all the reasons why. But what I also would do is bringing in those stakeholder groups. And it's very difficult with medical doctor groups around the world, I would say. Nowhere is any different. There are a few countries where there are medical groups that fully support self-care, because this is just going to allow doctors, physicians, GPs more time for their patients, for the acute patients, for the patients and consumers who really need their support. So it's going to benefit everyone. But I think that one key thing is bringing those stakeholders on board, and that's what we've done. We've formed a United for Self-Care coalition. So this is a global coalition, but you could mirror it in different countries. So we've got groups like FIP, which are the international pharmacists, but there's a group in every country. We've got IGEPHA, the International Alliance of Patient Organizations. I'm sure there's a group in Austria. We've also got the World Patient Alliance, International Federation of Aging, International Council of Nurses, International Council of Midwives, PATH, a global player in healthcare and prevention, and many more. We've got about 22 at the moment, and always bringing more on. Self-Care Trailblazer Group, another one. So in a way, maybe you could mirror that, but bringing those stakeholders together and then going to government and saying, listen, we're united, and this is what we're striving for.
That's funny because that was the recommendation of most of my interview partners. So
really?
there must be something into coalitions. Well, thank you, Judy, for your enlightening insights into your work and efforts to enhance self-care worldwide. It was great to have you here, and thanks for being with us today.
Thanks, Christina, and season's greetings to you and everyone at IGEPHA.
Thank you. This podcast series demonstrates the vast potential and positive impact of strengthening self-care. If you're interested by the benefits of self-care and wish to dive deeper into this potential for healthcare systems, I'm eager to discuss further. Contact me at office@igepha.at. Thank you for engagement and for tuning in. Join us soon for the next podcast season of IGEPHA im Gespräch.